Okay, so today I was going through a range of questions that I created for myself, and one of the questions were about brain abscesses, and for me to remember how to treat people that have a brain abscess. I know that usually abscesses are drained, but also the patient needs to be given antibiotics because obviously there's an infection there. So I just needed to find a way to remember what antibiotics needs to be given. So the two antibiotics that need to be given are actually one called, or third generation cephalosporin and metronidazole. So in order to try and remember this, I'm going to draw a brain. And if you haven't watched my previous video or other videos, I don't claim to be an artist. I can't even draw very well at all. But the idea is that you find a way to create imagery that makes sense to you. It doesn't matter whether it's complicated, whether it's elaborate, just as long as you understand it, that's what matters. So I'm gonna go in, drawing a brain, because that's gonna be the character today, an actual literal brain. It's okay to use literal imagery, because sometimes it makes it a lot more easier to remember. So yeah, I'm just gonna draw a literal brain, draw the gyri and sulci. Yep, try and make it look a little bit more like a brain. Yeah, so that's that. And then now my intention is probably to make this brain into like an active one, because I want to make it a brain because it's a brain abscess, right? So let's think of how we can incorporate a brain abscess into this. So maybe we could give the brain a body that has abs. I don't know whose brain has abs, but look, if it works, it works. So yeah, let's give it a six-pack and some legs. Ooh, don't know about those legs. Let's give it a six-pack and some legs. Maybe we can make it look like it's running or squatting, for example. Let's maybe do that. Give it some legs. Make it squat or run. Make it squat. Okay, let's pretend that the brain is squatting. Okay, hopefully you can see what I'm going for there. Yeah. Okay. So that's a brain abscess. So it's a brain with abs, brain abscess. And then we need to incorporate the cephalosporin and the metronidazole. Okay, so cephalosporin, we can use the word spore and turn that into sport. So it would make, it'll be fitting with the theme we're going for, a brain with abs. So let's make the brain with abs look as though it's playing a sport. So if we can just draw a football, which is a popular sport in the UK. So a football. We pretend that the brain is kicking a football at a metro. Pretend that it's kicking it at metro. Or a train, whichever one you want to go for. I'm just thinking of which direction I want the train to be in. Maybe this way. Okay. Like I said, I am not a drawer, I'm not an artist. So I'm just gonna draw whatever a train looks like in my head. Passing by. Oh, not like that. Okay, we can give it a little one of these. Act like smoke is coming up. I don't really like that, but yeah, something like that will be alright. And then trains tend to have like windows and doors, of course. So let's do that. Okay, so that's a brain with abs kicking a ball, which is R symbol for sport, for cephalosporin, train, or metro I should say, for metronidazole. So just to make it more, I don't know, a bit nicer, like, you know, I like to make my images into characters, into people for some reason, whatever reason that might be. So that's what I'm going to do. I'm going to continue with that theme, give it a little smile, some eyebrows, and just make it as memorable as you can, because the more funky the imagery is, the more memorable it is. So I want to give it a little band as well, because it's playing a sport. So let's give it a little band, yellow band or something. Oh, maybe a bigger one coming from here to here. I'm not sure about that color, but I'll just draw it like this. This stuff is not like necessary, because you can really just leave the imagery as it is, but I just like to do this part because these final touches, if you have time, help it to be more nicer to look at, if that makes sense. So yeah, and then we can add some color as well. Quick color, any color that you like. When I did it before, I was trying to be lazy, but wasn't didn't come out as nice as I thought it would. So I thought I should draw a border for it. And yeah, I don't like colouring outside the lines, but sometimes it happens and it just is what it is. But okay, so that's that. So that's the treatment for brain abscesses. So brain, I'm really sorry, I think the brightness went down a bit. Abscess. And just to help, I'll put the codes at the side. So I'll put the ball to symbolize a sport for cephalosporin, and metro to symbolize metronidazole. And I apologize if there are any spelling mistakes there. You know, I usually like to add some color, but I think I'll stop there. So thank you for watching, everyone, and God bless.